more about Sunway actually in this slide. So far, I've been in Sunway Medical Center for about 2 months now. Yeah, and I like it. All right, so here it's just a very cartoonish, simple um, cartoon about radiotherapy machines. You have CyberKnife, Gamma Knife, LINAC, MR LINAC, tomotherapy, and proton therapy. In Sunway, though, we don't have all of them. We have Tomo, we have CyberKnife, sorry, we have Gamma Knife, we have Tomo, we have LINAC. Yeah, so you can learn on your own what any of these do. If a center is to, if you want to build a radiotherapy department, you have to have a LINAC. That's like a must-have because it is used a lot to treat different kinds of cancer. So these are the Sunway's modalities. Here on the top left corner is the LINAC by variant. It's a variant machine. And on the top right, it's a tomotherapy. I don't really fully understand tomotherapy yet, but what I know about it is instead it's a LINAC, but it irradiates in a very thin slice, as opposed to when a LINAC irradiates a patient, it's a big field. Okay, and on the bottom right, you see a very nice room there. That's CyberKnife. Sorry, my bad. That's a gamma knife. It's mostly used. It's only used to treat brain lesions, brain cancer. And in the middle, you have a brachytherapy. Very small machine, but it's a powerful radiotherapy modality. And on the left, it's your regular CT sim. Patient will have to undergo this first in order for us to get the scan, and then physicists will plan according to that scan. All right, so another cartoon. By the way, all the cartoons are drawn by my boss. She's a great, artist, and very easy. She simplified things in a very nice way for patients to understand. So I want to share a little bit about the workflow of the when patient comes in. They first see the oncologist or doctors and then the doctors will diagnose them either according to their earlier scan or according to different clinical reports. And once they are cleared by the doctors to undergo radiotherapy treatment, they will undergo over here you see a CT stimulation. That's what the machine that I showed you earlier. Patients will undergo this machine to get the scan, and then this scan will be imported to our treatment planning computer or treatment planning system. This system is a software, but it is used by physicists to plan treatment. Basically, how do you want to angle the beam? How do you want to shield some organ at risk areas? How stuff like that. And once the treatment plan is done, it will be reviewed and approved by oncologists. And once that plan is approved, then the physicist will go and do a patient QA, patient-specific QA, using a phantom. And if that QA is passed, then we can finally able to treat patient. In the first day, and I think different procedures or different cancer will have different protocol. For example, breast case, you have to, the radiotherapist will take every day of the treatment, they will take an 3D image of patient so that every day they can reproduce the same setup as when patient was undergoing CT stimulation. This is very important because if you position patient very differently each day, then your radiation is not going to go to the place that you want them to go. Okay. Yeah, so that's that. And so these are the job scope of a physicist in the radiotherapy department. So you read journals, you treatment plan. You also, a very cool thing about being a physicist is you get to be like a doctor sometimes. You actually go through their medical records and read doctor's handwriting and see where are the tumor at. Usually doctors will define them in an area or quadrant or like 5 o'clock region, stuff like that. So, and you get to learn the chemo drugs that they use. So cool clinical stuff that you get to learn. All right. So a different part of a big and different part of medical physicists in RT is doing QA. So far in Sunway, I've learned Linux QA the most, and these are just some of the QA that you need to perform every month. And these checks can all be taken from TRS. I think that's technical. It's a document, technical something series 430. They are free. It's online. So yeah, one more thing about physicists that you need to know a lot of journals, a lot of documents, series, because it's going to help you basically. So the next part, it's contouring. So I think this is somewhat interesting because you get to define what does a lung look like according to the CT scan. So these are the things that I've actually contoured. On the bottom right, you see a lung, a pair of lung, and a heart inside. So in a scan, a CT scan, where's my cursor? Okay, here, this is my cursor. Over here, this lung here is actually the right lung. So when it's like seeing in a mirror, when you look in a mirror, your left and right is inverted, right? So it's the same as a CT scan images. What is left is right, and what is right is left. So this, where's my cursor? Okay, so this is patient's right, and this is patient's left. Okay, and yeah, so very cool stuff. You can change the colors and all that. This is, I just want to show you something. These are the eyeballs. On this green region here is the nasal cavity. This is the oral cavity. So when you do contouring, you follow certain guidelines or atlases to define certain regions, like what is the superior border, what is inferior border, lateral and medial border. These guidelines you have to learn, of course, but yeah, you can. I don't remember it. Even senior physicists don't really remember it. When they forget, they'll just look through a book and this is where you stop contouring. So yeah, it's easy in that way and also fun. Like it's like drawing, right? Okay, so the next part is pretty exciting. Is treatment planning. Okay. So in my time of 2 months in Sunway, actually, when you become a medical physicist in RT, for the first 6 months, you are only to do 3D conformal radiotherapy or 3D CRT conformal technique. And mostly it's breast or pelvic region, the easy ones. So I've done a lot of breast. So I'm going to showcase breast cancer. So radiotherapy for breast cancer, it's not the first line of treatment. The first line is surgery and then chemotherapy. And the third line is radiotherapy. So the treatment is 40 gray in 15 fractions. So that's about 2.67 gray per fraction, okay? About 3 weeks. If doctors or oncologists deem that they need to boost the tumor bed, they will use electron boost with 16 gray in 8 fraction. So yeah, so this is just another 3D uh, model of the patient scan. I show you this because there's two purple lines here. This line and this line, they're actually wires, copper wires. When patient undergo the first CT scan, RTTs will position the wires to let the physicist know that this is the medial border and this is the lateral border, so that we know when we plan, we know that we don't go beyond or just slightly go beyond, because we don't want to irradiate the contralateral breast or other healthy tissues. So these are the two borders. Okay. Here, this is an axial or transverse scan of the patient. Again, over here is the right breast or right lung, and I highlighted two features here. On the blue circle, that is a surgical clip. Usually surgeons will input, once they took out the tumor, they'll input a surgical clip to denote that this is where the tumor was at. So when we do boost, we know where to boost. And the red one is just a marked ball bearing from RTT to denote that this is the scar. Yeah. Okay. And you look at this two purple thing here. That is the medial, and that is the lateral that I showed you earlier. So yeah, see, I didn't go over that much, and I stayed inside my lateral border. Okay, so here, so when you open up a field, like this is a field, this whole thing is a field. There is little features called MLC, multi-leaf collimator. This multi-leaf collimator is used to conform to a certain object or certain organs, to shield them away. So the reason why I have these like the way they are is because I want to shield away the hot spots. When radiation comes into a patient's body, it wants to go somewhere, and sometimes the dose will accumulate in one region, and then it becomes really, really hot, and we don't want that because it will burn the patient. So these MLCs will be used to shield those areas so that there'll be no more hotspots and evenly spread out the dose to the rest of the surrounding tissues. So that's one in conformal. That is how MLC are used. Okay. So here is another axial slice, but this slice I show you the superior border, which is the top border of the field. The red circle here denotes the SSN. It is known as SSN, supra sternal notch. So it is the top. You know, you have a sternum here, right? It is the top of the sternum. When the sternum starts, that's where you stop your field for breast. Okay. So usually for breast, if there is a lymph node involvement, you learn about this, like the staging for breast, T and M. When lymph nodes are involved, doctors usually want also to treat the SCF or supraclavicular fossa, which is this. Basically, it's the clavicle here. You want to treat the clavicle as well. Okay. Okay. So I showed you the left. Sorry, I showed you right breast, right? And this is the right. Hey, my bad. I'm sorry. See, I'm confused. I showed you the right breast, and now this is the left breast. Both of them are left breast. So what is the difference is that the heart, you see on your left side here, the heart is very little, or it is far away from the chest wall. And on the right side, the heart is very close to the chest wall, touching even. So there is a technique called deep inhalation breath hold, or DIBH in short. When patient has a left breast cancer, usually they are recommended to do a DIBH treatment or scans, because if they breathe freely, there's a high chance that a lot of those will go into the heart, which we don't want. The heart cannot exceed, the heart cannot have 30 gray more than 46% of its volume. That is standard. Lung has a tolerance limit too, which is 20 gray cannot be more than 30% of the volume. Okay, so if the left image here has a reduced heart because patient breathe in and hold it, and so you have a bigger space for us to treat and not jeopardize the heart. Okay. Don't know why I showed this, but let's skip that. Okay, so I think you guys can do this actually as a practicing, if you want to know more about contouring, you can actually go here. I can type it up in the chat later. This is a free software. I use it to contour, to check my contour if it aligns with other oncologists' contour, because this website gives you a feature where you can contour and score yourself against other people. So that's kind of cool. And here it's like it is literally the same thing as what I do at work. So it's a pretty cool tool to use for yourself, and it's free. All right, so this last slide is it's kind of fun actually. So these are called thermoplastics. It is used for when patients they have a head and neck cancer. So it's a immobilization device where you actually mask the patient to the bed, to the couch, treatment couch, so that they cannot move their head during treatment. That'll be bad if they move, right? So once they've completed treatment, some patients actually requested they want to keep this as a souvenir. So some of our RTCs took initiative and actually did that. It's a pretty cool art, I think. Yeah, so that's it for me. Yeah, thank you. How do I end?
Thank you, Joshua. It's very interesting.
How do I end?
How do you
okay,
end?
stop sharing.
Okay. Any question from the students? The first year student, I believe that it could be a lot of foreign words that you heard from Joshua just now, if you haven't learned about radiotherapy. But hopefully you get at least a bit of idea what does a medical physicist do, what is the job of medical physicist, and honestly, it sounds very interesting. I'm very jealous as well. Question? I should come sometimes. Any question? Please take the chance.
Hi, Joshua.
To ask a question.
Can you hear me? Is my line okay? Thank you for your sharing. I just wanted to know about the breast cancer treatment. What type of bolus that you use for treatment?
Bolus is only used when we cannot get a skin coverage. Usually bolus is not used unless so let's say the breast is really big, and so you want to cover deeper, so you use higher energy. When you use higher energy photons, it penetrates deeper, so you lose some of the skin coverage. So that's when we use bolus to bring out the dose to the skin. Does it make sense?
Oh, yeah. So what type of bolus that use?
Oh,
is it super slab or what gums or what?
They use wet gauze.
Oh, okay, all right.
Any other question? You can ask how you find a job whatsoever. Anyone would like to ask any question? You can type in the chat box. If you're shy, you can just personally text me as well. I can read the question on your behalf. Or you can wait later after all the panel has presented, also can. And Joshua, there's one question. Do you enjoy your job?
Love it. It is pretty long though. Yesterday I got home at about 11 because sometimes doctors same patient in one day and then they want to treat the next day. So we have to, oh my gosh, how do we treat this? I have to plan and stay back, but it's fun. Not always, but sometimes.
Doctor, I have a question.
Who is it? Shira. Okay, Shira.
Shira. Thank
Okay.
you, Brother Joshua, for the sharing. I am currently doing my internship in GHP Ning. I want to ask, was your master in USM really help you in your job scope now? It is like a personal question, but I really just curious. Yeah.
Anatomy helps a lot, really a lot. Even if you go to nuclear medicine or diagnostic radiology or RT, you have to look at scans, and if you don't know what those things are, you are not gonna know what to do. Of course you will learn, but that's why I'm saying now, if you learn anatomy pretty well and use the that software, I think you have an edge. Yeah.
I think maybe she also wanted to know. Okay, maybe you should tell them that your background is actually physics, so your knowledge on the medical physics only for during master. Maybe that kind of experience as well.
I don't understand.
Because now at the moment they're just doing an undergraduate, right? So they may be thinking whether they should go for master study or not. So they maybe don't want to have a bit of experience from you.
Yeah.
Yeah, that's a question, I think.
Yeah,
Whether it's helpful or not.
I believe master's is required, right? If you want to get a job in a physicist. So I think you should go for it. Okay. Since I don't have any background in medical physics, what I learned at USM did help me a lot, especially diagnostic with the class diagnostic, because it was my first time that I got to learn a bunch of modality, mostly nuclear med. It was interesting, and yeah, so I think it um, it helps me to understand what those things are in a physical way. As because I like to know how things work. So if I know that, then I can do it well. The radiotherapy, though, maybe because it was COVID, and so we didn't have a long time to study, so we only learned a very small amount of material. So that is, I think, it's one of the, I guess, a downside of masters. But majority of the classes that I've learned in the master's program has been very helpful. So yeah.
There is a lot of question asking whether planning to further study, what should you consider? And if you're not medical physicist, what job you will take?
What?
You're taking medical physics course because you want to be a medical physicist.
Yes. So medical physics is not my first degree. I actually have another master degree in physics, and the reason why I got into medical physics or get my second degree is because I love physics and I want to be in healthcare. So it's like the best of both worlds. So I did that. So um, I don't know if I don't know. I still think that I want
Okay.
to pursue my PhD in medical physics. So
Yeah, to get to know deeper into the subject, perhaps. Yeah. Hopefully soon. I just want to clarify a bit about master. So most of the students actually maybe considering whether you should take master or not. I would say that if you are thinking to be a medical physicist, please further for master, because at the moment only government does not require master. So with the degree, you can still enter government hospitals. However, the post is very limited. They maybe just have like 3 to 4 posts per year. And if you want to work in private hospital, master is a must. It's a must. Sorry, yeah. So you basically they can only hire someone with a master for a medical physicist job. So you have to have master if you want to work as a medical physicist. Anything that you considered before you continue for your master? Only that because you're interested to know further. And then, so what is, if you are not working as a medical physicist, what job do you think you will do?
okay, that's okay. This is more personal, but I think I'll be a preacher.
All right. Okay. Can someone with no bachelor degree but can apply job as a medical physicist and wait? So like I've mentioned just now, you need a master to be a medical physicist in a private hospital. No bachelor in degree but master. Okay. To be a medical physicist, your degree have to be master actually. Physics. Then only continue for medical physics at the master levels. So the requirement actually supposed to be physics.
Doctor, I need to ask,
Yes.
even if my degree in diagnostic imaging and radiotherapy, is it okay?
I'm not so sure. There are some who may be hired, but from my own understanding, it have to be physics, or maybe they will just take a look at your master. I'm not so sure about the private setting. Yeah, but in the government, I think you have to have at least a physics background in the undergraduate levels. But Joshua, maybe you can answer that question.
I think
don't
you're
know.
better at it because I have no idea about the qualification part at all.
Yeah. But at the moment, I think they require a master for medical physics. I'm not so sure if they take a look at their undergraduate.
Doctor, I just want to share.
Who is it? Okay,
Shira.
Shira.
Our supervisor at GH Penang also advises us that government also now in the planning to take only master student to pursue medical physicist in government. So yeah, I advise you to
Yes,
take master.
I know that, but since we are not, it's still drafting, but I would actually encourage you if you want to be a medical physicist, master is a minimum requirement that you maybe want to think about. Yeah. So because if you're just like waiting for the government post with only degree, so most of the time you maybe end up have to compete with those seniors, your own seniors, which is already have masters. So they will actually hire someone with a master rather than the degree, even though the minimum requirement is. Is medical relation course same as medical physics? It's not the same actually, but it's quite controversial to talk about this. Medical physics is actually really physics, as it says over here. Medical physics is physics like in if you take a look at the course as well, in undergraduate levels, you have a lot of physics compared to the medical physics component, because we follows almost what been practiced internationally, where undergraduate you will actually have a portion of physics, and then at the master levels you learn about medical physics. So that's how it differs, because medical radiation is supposed to be catered. I shouldn't talk about their program, but they have very less physics compared to those from medical physics. Because if you go internationally, they want a medical physicist to have a strong background in physics. Joshua, another question for you. What are the challenges you face at the beginning of the career and how you overcome it?
Wow, very personal question. Yeah, not simple, but somewhat simple. Faith, family, friends. Those are the things that help me. Stress or challenges. Yeah. Find your.
Or on your own patient. There are a few other more questions, but can we answer it after all the panels have done? Because now already almost 9. So we can we move to the next panel, and then later on we come back to the questions. Okay. Aslam, are you ready? You're already in, right? Are you ready, Aslam?
Hello.
Yeah, boleh dah.
Boleh.
Yes. Boleh share slides ke? We actually have international students as well. Are you going to share slides?
Okay, wait.
Okay.
We got international student.
Yeah, we do have international students. You maybe want to explain a little bit about your background before you get into your work. Introduce yourself a bit.
Okay.
When you graduate. All right.
So my PowerPoint pop up on your screen, right?
Where is your video? I need to see your current face after you're working.
Okay. Okay, wait. Okay, before that, Assalamualaikum and very good evening. My name is Aslam Husaini bin Ahmad Timizi. I graduated in medical physics in 2019. Last 2 years. Okay. So my current job description is QC assessor ataupun QC engineer lah. Which is we do a third party that required by the class H by the KKM. The KKM also known our job as a class H or consultancy medical physicist. Okay. So I start about what my department is known as. So firstly, first my department also known as medical radiation service. Okay, medical radiation service. So my company is ALIPS, formerly known as Asia Lab. So we have 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 5. Our branches. So our HQ is at Subang Jaya, Kemaman, Emiri, Labuan, and Kuwait, and Indonesia. So basically, my department is at Subang Jaya, in Subang Jaya. So basically for Kemaman and Miri, our business is more on oil and gas or offshore lah. We say the offshore, also for Labuan branch. So what I want to share here, beside class H or my job as inspector or a third party that required by the KKM, our course also can go for the offshore or oil and gas, because our business for offshore, we basically we playing with the source. And for example, we use the cesium cobalt 60 that we are using for oil piling. So these are the example that our course also not in in medical physicists only. We have many more branches that we can go after studies. So for example, my job as well, class A, so offshore also, especially for the men lah, you guys can try go search for the offshore that company business that using the source for checking, for inspect, for example, the non-destructive testing. So NDT, my company does not do the NDT business, so you guys can search what company that did the NDT work. Okay, so moving on. Okay, this is vision and mission. So you guys want to know, so I read one time lah, to be one-stop solution provider for occupation, health, safety, security and environment assessment, certification and advisory service. Dr. Nick, okay ke? Hello?
Ya, Aslam. Khusyuk tengah
Okay, okay,
khusyuk
okay.
tawaduk.
Okay, okay. Okay, so my vision, my company vision is to provide occupational health, safety, security and environment assessment certificate. So for example, certification ni, we have to get the certification from KKM, from Kementerian Kesihatan Malaysia, to get the certificate for example, this machine general X-ray, where are the certificate that that came from what company, what consultation company. So the consultation company, for example, is our company lah. Okay. And advisory service. Advisory service ni more to radiation protection consultant, RPC. So advisory service ni, for example, few company have to hire a few consultancy. So to hire the consultancy ni means that this RPC will guide, will look into what the company is doing the business with the radiation material. So our mission to help customer creating a safe and secure environment for their employees, business partner and community around them by delivering quality service and industry relevant. So we have to creating a safe and secure environment because we are dealing with the radioactive material. So that's why we have to we are creating a safe and secure environment. Okay, moving on. This is our credential lah. Alips, my company is one and only the company that got 2 credential from ALB along with KKM. So basically for our job, for my job description is we require to get the class H license. Class H license basically we get from the KKM. So for our job is class H lah. For other business such as we dealing with the source, that's business, our certified is from AELB, Atomic Energy Licensing Board. Okay, that's a different credential lah. So if one company want to make the business with the only class H, so that company need to get the class H only, no need to get the AELB license. Okay, if not understand, after this can ask me question lah. Okay, next. Okay, ni achievement, tak payah tahu. Okay, our services. Okay, so basically our services, as I said just now, medical radiation service. Medical radiation service is consisting of quality assurance for irradiating apparatus and associated facilities. Next, we also have laboratory service, training service, and radio, and one more, I'm not sure. Okay, we just focus in these 3. So medical radiation service, as my job description right now, we did the QA at hospital, clinic, swasta clinic, and also veterina. So laboratory service, radiation dosimetry service. So this job scope is we analyze the OSL or TLD and also RPL. So basically our company we dealing with the OSL. So what is OSL? Later nanti I akan tanya OSL tu apa. Okay, next training service. Training service ni continuous medical education or continuing professional development. Continuous medical education ni basically is we as a worker, how we want to maintain our knowledge, or we want to make sure that our employee masih consistent about their knowledge. So we provide the CME or CPD. So basically every staff in the hospital that dealing with the radiation, they have to renew the CPD point. We call it CPD point or CME. So with this training service, their knowledge about radiation, their awareness about radiation is continuous and not forgotten. That's what I mean. Okay. Okay, next. Okay, solutions. So solution ni basically it's explain about what is the procedure for each equipment or for each machine. So as we can see here, we have radiography system, fluoroscopic system, dental system, and computed radiographic system. Tak berapa nak nampak sorry . So radiographic system, first one, general and mobile radiography lah. So general and mobile radiography ni basically for general X-ray and mobile X-ray. These two machine is basically is the same machine lah. So the procedure is the same. The difference only for mobile, we haven't the scattered test and also the timer test. So for fluoro, dental, and computed radiography, it has their specification for each procedure. Okay, so as you can see for this procedure, it is an interim procedure. Interim means sementara. How do you mean sementara maksudnya KKM provide the procedure just in case the company itself does not have any procedure yet, so they can use the KKM procedure interim, like Prime Minister interim. So that's what I mean lah. Okay, next. Interim. This interim. Okay, interim. Sementara sementara punya prosedur. Mana tahu contoh kalau company tu tak ada lagi prosedur, dorang boleh guna interim ni sebagai prosedur dia. So bila once the company has came out with the procedure, so they don't use the interim. They use their procedure. As long as their procedure is aligned with the interim. Okay. Next, quality
Sam, are you
assurance.
still sharing your slides? Kenapa hilang your slides ni? Ke saya je yang tak nampak?
Tak tahu, jap. Hilang ke? Dr. Nick, nampak Dr. Nick?
Sekejap tengah buat kopi.
Ada tak dekat ni Dr. Nick punya ni?
Tak ada.
Tak ada?
Tak ada, hilang.
Okay, jap saya share sekali lagi. Sorry
Asal videonya tak nampak muka pun.
Oh, tak nampak muka. Oh, ya ke? Okay, sekarang slide dah keluar dah? Sekejap Okay. Okay. Slide nampak dah, Doktor?
Okay. Dah.
Slide nampak dah?
Ya, nampak. Okay.
Okay. So quality assurance. There is the example for machine that we are dealing with we do the QA. So we have here angiography, bone dosimetry, CT scan, mammography, C-arm, general radiography. This one OPG known as dental lah. So for dental we have two, intraoral and OPG. These are the example that we are doing the QA machine. Okay, next for bone dosimetry, my company not doing it yet because not tak ada business lagi. Okay, this is the phantoms and tools that we use. So we have here survey meter, Victorine. So you guys as a degree student should know lah what Victorine, what type of detector, gas detector ke, apa semiconductor ke, yeah, you guys should know lah. This is very important. So we also have the phantom for general. So this is for CT scan, this is for memo. These two is basically is the same. So at the moment my company use this meter. We call it Cobia or Piranha. So this meter we basically use for KV for generator performance. So when we want to test the KV or linearity or repeatability, we use this meter. So we connect this meter to our laptop. When we expose the X-ray, the reading will automatically receive in our laptop lah. So this is our innovation that certain company did. So we also have this one for detector, external detector, and this one we measure the lux. Lux ni we measure the light, lux and candela meter per square. The unit of the light is candela meter per square. So moving on, okay, dosimetry management. Dosimetry management, okay ni. Okay ni. Annual dose limit for a radiation worker. Okay, yang ni I believe that in class our lecturer have taught us about how much the limit each public for each dose. So as for example, as a radiation worker, how much dose we have to reach in a year for public, for student. So basically this for whole body for radiation worker lah, 20 millisievert per year. So for woman that pregnant, woman radiation worker that got pregnant, the dose to the fetus is less than 1 millisievert during pregnancy. So maksud dia kat sini 1 millisievert direct to the fetus, bukan 1 millisievert direct ke badan perempuan tu So 1 millisievert direct to the fetus. So maksudnya perempuan tu semua dari kepala ke kaki 1 millisievert lah. Okay, tu je nak cerita dia. So next. Okay, tak ada apa. Okay, ni dosimetry management. So my company, as I said just now, is doing the business for analyze the OSL or dosimetry. So basically, this is for your explanation, for your gambaran. Because when I was student, nobody told me how we want to process the OSL, what company that dealing with this business, so that when we knew the company that dealing with this OSL, maybe we have the opportunity to send our resume, for example. So macam ni, benda-benda ni penting sebab kita orang dulu tak dapat pendedahan ni macam ni kan. So dosimetry management ni macam contoh satu hospital dia nak hire, they want to hire us to analyze their OSL, because each hospital or each group that handling with the radiation source, they have to wear the OSL, TLD or RPL, because this is as gazette in the ALB. So first of all, according customer info, registration and data entry, assign OSL batches 2 unit per user. Okay, scan to measure initial dose before we send to the customer. We scan the initial dose first, then assemble the equipment, then deliver to the customer. Then the customer or radiation worker wear OSL for a month. Then after a month, they return the batch to a laboratory. Okay, laboratory that recognized by authority. Who the authority? AALB. So the company that authorized by ALB only can dealing with this business. So when we have returned the batch to laboratory, unpack, disassemble and scan to measure the dose, scan OSL to measure the dose. So this one is to what is equivalent dose that we get for a month. So OSL ni saya nak tanya apa dia punya what they detected, absorbed dose ke, effective dose ke, equivalent dose. Boleh jawab tak? Siapa Dr. Nick petikkan nama?
Kenapa saya je?
Tak saya nak tanya student doktor, OSL ni detect effective dose ke, equivalent dose ke apa? Okey, tak apa, kita buat Q&A. Okey, so bila kita dah scan, kita masuk ke OSL reading, dia baca berapa dos, so invoice keluar, duit keluar, money out, then generate dose report, review and approval, send back to the company that dealing with the OSL. So send to EOSL portal. EOSL portal ni the function is not also the company that will know our doses. So as the authority also will know what this radiation worker has exposed in that year or in that month. Okay, training service, continuous medical education. So I said just now, this is for radiation worker, radiographer, also doctor that handling with the radiation source. They have to attend this CME or CPD. So hello,
Dengar.
Ada tak doktor?
Ada. Nampak.
Okay, so untuk CME ni, for CME continuous medical education, purposes to continue that each worker, their knowledge about the radiation or awareness is continuous during their work lah. So continuing professional development, CPD point. So example for me personally, when I've worked for this job description, after 1 year, after 2 years, I have to attend the CPD point. So I have to collect what range of CPD point that I have to achieve, so that I can renew my RPO, or also known as Radiation Protection Officer. So that is the function lah. So other than my company, MNA also provide this training. So any radiation worker that want to increase their CPD point also can attend to MNA or ALIPS lah, my company. Okay, so this is, for example, this is my our training schedule lah. I don't know either this date is applicable because this our duration now is PKP . Mungkin cancel ke apa, saya tak tahulah. Okay, thank you. Itu je lah saya nak share. Okay, lepas tu selain saya nak share, benda ni penting juga. Other than my company, there also that other company that provide like our job description, such as MPS, Medical Physics Services Sendirian Berhad, Gamedik Sendirian Berhad, Sinaran Consultancy Sendirian Berhad. So these are the company that you guys should take note on your future, ataupun tujuan lepas ni nak hantar resume company apa. Faham tak? Macam contoh, sekarang ni kita terlalu, bila habis kita grad, apa company yang medical physics ni buat? Apa company yang ada medical physics ni kan? Kita macam tertanya-tanya apa benda. So saya nak bagi contoh company saya sini, perempuan pun boleh. Macam tadi lab tadi, perempuan adalah peluang tu, lelaki pun ada. Tapi jujur saya cakap, benda ni kelebihan dia banyak kepada lelaki. Itulah, kalau nak tanya apa company yang buat lagi, bolehlah saya jawab lepas ni. So itu je saya nak share. Kalau ada apa-apa soalan boleh tanya. Terima kasih. Thank you.
Thank you Aslam.
Okay.
Nampak matured sangat. Okay, sekejap. Boleh tak nanti bagi kat saya list yang tadi senarai company tu, just in case mungkin
Boleh
kita boleh
boleh
contact
saya tulis kat sini
orang
lah, saya
internship
tulis kat
ke.
tepi ni.
Slide ni boleh bagi kat saya ke?
Boleh boleh boleh.
Ya, Dr. Nick ada nak tanya ke siapa tadi?
Tak tahu orangnya dululah, anak bising pula Ustaz.
Tu Dr. ni.
Aslam, ada question for you. For fresh graduate security position at ALIPS, is it compulsory for us to have specific certificate? Or
Okay,
Aslam, are you
untuk
actually have RPO punya certificate?
actually I
Memang
did not
ambil.
saya tak ambil pun RPO. Saya baru exam minggu lepas. Okay, so
Correct.
nak itulah exam dia. So saya nak cakap ni RPO certificate ni even kalau korang tak ada kerja lagi pun, korang tak ada mana nak apply, kalau ada duit lebih bolehlah pergi ALB daftar untuk ambil kursus. Dia punya kursus hanya 2,500. 2,500 tu lepas tu ada exam dia 200. Ambil je ni, tak adalah kita nak kata confirm dapat kerja. Tapi kalau bila kita dah hantar resume tu adalah apa kita nak letak. Selain ada degree kita ada RPO. So senang sikit lah kebarangkalian tu untuk dapat kerja kan. Okay, itulah jawapan saya. Saya tak ada RPO pun sebelum ni.
Okay. Aslam, in USM last time, are you a good student? How's your CGPA? Your company they ask CGPA.
Itu kena tanya Dr. Nick. saya good student ke tak, tanya Dr. Nick. Dr. Nick ada jawapan dia. Lepas tu, how your CGPA? Boleh lah untuk dapat kerja. Your company they ask for GPA, okay, dia tanya CGPA tu penting jugalah sebab dia nak tengok apa orang panggil macam job description as I hired right now. CGPA tu dia cakap tak nak terlalu tinggi, tak nak terlalu rendah sebab because your CGPA is too high, there will probability that the student will jump to another good company. So saya nak cakap macam contoh kalau CGPA awak terlalu bagus, mungkin dia tak.
Betul ke apa ni?
Apa dia?
Kau tak payah belajar bagus-bagus sangat ke apa ni?
Bukan tak belajar bagus. Dia macam tengok kepada business company. Macam tu lah. Aslam max GPA now is 2.4. 2.4 kena buat naik lagi. Okay,
How about the market sector?
Market sektor ni membangun ke di Malaysia? Okay, untuk macam business yang sekarang job description saya ni kelas H memang konsisten lah. Sebab setiap hospital ada general X-ray. Bila dah ada general X-ray, benda ni QA annually, tahunan. So setiap tahun memang kena renew. So satu hospital bukan ada satu general X-ray, so dia ada banyak. So benda ni orang kata apa, takkan bisnes ni takkan apa susah lah nak ni sebab dia memang requirement by KKM ALB kan. So membangun ke tak tu dia tak adalah membangun yang kita nampak kalau main trading tu, tak adalah graf kita terus mencacaan. Dia adalah, dia still ada, dia konsisten. You enjoy your work life, you not worry because so much radiation. Kalau Farid ni orang luar
Saya tak pastilah siapa.
Okay, so Farid, Aslam SGPA now is 2.43, is okay. Kena buat naik sikit. Aslam, you enjoy your work life. I'm enjoying my current working life because every month travel. So pergi negeri lain, so nak buat kerja kan. Pergi hospital sana, pergi hospital sini. You not worry because so much radiation. So my exposure monthly, it is not exceed 1 millisievert per year pun. Dia paling-paling pun 0.6 millisievert per year. So it's too far to reach the 20 millisievert per year. So don't worry because we have practically do the radiation protection principle or system during our work. So that is no worry for the exposure by the radiation. How do you decide that this will be your pathway? Rezeki lah kot.
Sabar je.
Yang tanya Aslam good student tu dia Aslam ni is macam penyeri dalam kelas lah. Kalau satu hari dia tak ada tu tak best lah. Okay Aslam, can you share us your experience dalam interview to get this job?
Oh, interview.
Doctor, can we just like, because now it's already 9:20, can can we keep the question to
Ah,
later
okay.
on
Oh,
after
boleh,
next session?
boleh, okay.
It's okay. Boleh.
In next panel dulu. After that we collect all the Q&A again. Okay?
Okay, thank
Thank you.
you.
Jangan
Okay, bye, Aslam.
Oh,
we'll
jangan
have,
end,
we have
jangan end lagi ya?
Ya, jangan.
Okay.
Thank you so much.
Okay.
Are you ready? Saya Ansha ya.
Hello? Hello, Doktor.
Yes. Boleh.
Ya.
Assalamualaikum.
Yes, can.
Sekejap saya share Aslam Nabila punya slides. Saya ada dengar bunyi
Hai, Nabila.
sekejap
Hai. Hai, Doktor.
Saya ada bunyi macam
Ya,
ada
ada
background daripada siapa Nabila
Hello? Dengar tak?
Jangan, cuma saya ada dengar noise. Sikit noise. Okay, now dah tak ada.
Hello?
Okay, ada sikit-sikit lah, ada macam bunyi background sikit. Saya ada dengarkan suara sekejap.
Boleh dengar tak, Doktor?
Okay, boleh. Alright, kita akan move to another panel.
Boleh,
Nabila. Dengarkan, saya punya suara pun dengarkan.
Dengar.
Okay, so Nabila working as a product specialist at Umi Surgical, Sdn Bhd. So maybe you can explain a bit about yourself before you get into your research.
Okay, so everyone
Macam
can
ada
hear me,
lebih
right?
Nabila kot. Saya rasa daripada Nabila kot.
Oh, kejap.
Macam ada scratch.
Kejap. Hello? Hello, Doktor. Boleh dengar tak?
Still ada. Tapi okey lah kot. Still boleh dengar kot. Alright, better.
Hello, Doktor.
Ya, boleh dengar tak suara saya?
Can you hear me?
Dengar tak suara saya? Yes, we can hear
Oh,
you.
still ada noise ke?
Ada lagi sikit.
Still boleh dengar,
Boleh. Boleh proceed lah kot.
Okay. So, hi everyone. So, I'm Nabila Fahana binti Bakri. Saya boleh dengar. No? Okay. Okay ke?
Okay. Mungkin datang daripada wire kot dia punya sound.
Hello?
Okay.
Okay, saya boleh start.
It's okay lah, you can proceed. Boleh. Boleh proceed.
Hello? Oh, ya ke? Kalau saya cabut, okay tak?
Boleh. Boleh go.
Saya pasang balik.
Boleh.
Can hear?
Okay. Boleh.
Okay, so saya start. Okay, hi everyone. So, okay, can you? Boleh Okay, so hi semua. So I'm Nabila Fahana binti Bakri from very good no wire, so I cabut lah. Is it? Can hear? Alright. So okay, so hi. Doktor boleh share to the next slide tak? Hello, Doktor.
Dah next slide kan?
Okay.
Ya.
Okay. Okay. So first of all, saya would like to say thank you to the organizer for inviting me. So thank you so much, and especially Dr. Sakina, Dr. Nashkin. Hi, Doktor. So saya punya slide ni is a very like simple sangat-sangat as compared to Mr. Joshua and Mr. Aslam. Okay. So sebab saya itulah not really have time to do this. Okay. So I introduce myself. Okay. Nama saya Nabila Fana Bakri. So my colleague, I will believe that my colleague pun ada sekali sekarang. Okay, and I'm from Foundation in Science, UiTM Dengkil and Puncak Alam. So saya adalah first batch yang duduk dekat Puncak Alam and Dengkil at one time. So 2015 to 2016, and then continue my degree dekat USM Medical Physics 2016. Then graduated. We were officially graduated last year in 1st October 2020, and insyaAllah this year hopefully we can graduate. Okay, our colleague and also with this batch, insyaAllah. Okay, so actually I'm quite afraid to receive this kind of invitation to have a sharing moment sebab saya tak banyak lagi pengalaman kerja ke. Okay, it's not even setahun jagung. Okay, so I do my internship at Boston Scientific medical device starting from February 2020 until August 2020. So my this kind of sharing session may be more to industry, medical device industry, because I'm internship there, okay, in medical device industry, and also continuing I work as a product specialist also in medical device industry as a at UMMI Surgical. Okay, actually it's not UMI. It's not like yang nasyid like UMI yang lain, it's not. Okay, it's pronounced as it stands for United Medical Malaysian Medical Industry Surgical Sendihan Berhad. So I'm starting working after graduate, okay, November 2020, and still currently. So it's about like 6 months. I'm working as a product specialist at UMMI Surgical. Okay, got to next. Doktor.
Nampak tak? Dia mungkin delay sikit. Saya dah next kan dah. Nampak next tak?
Oh, you got.
Do you
Okay.
see the message?
So,
Nampak?
yes, dah. Okay, so I'm currently saya just directly through my job scope. Okay, so okay, in this kind of session I will share my experience internship dekat Boston in the phase of when you internship dekat in the phase of internship. Okay, for siapa yang 4 years sekarang, okay, for those yang dah last year and currently doing the internship. Okay, in the process of doing internships and then a job application until you secure a job. So actually it's very hard to secure a job in the midst of the COVID-19. Okay. So currently working as a product specialist. So I'm as a UMMI Surgical is a company that brings the Medtronic product. So Medtronic product, if you know about the medical device industry, Medtronic is one of the big company also in worldwide. Okay, so my job scope is actually I work closely with orthopedic surgeon. Okay, and part of trauma team. Okay, as you know in the hospital actually sebenarnya my job, okay, my job ni is it's not something yang related to medical physics. Okay, tak related sangat. It's not related. It's not that kind of related lah. It's just like dalam 30 to 40%, but it's still like it's kind of interesting sebab masa saya when I intern in Boston Scientific, so actually you have to actually for the juniors lah, okay, you just not macam open you have to open up your mind. It's just not okay. You take the medical physics, you have to be medical physicist. Okay, you have to continue master. Actually, yes, memang if you want to continue your you want to be the medical physicist, memang truly you have to, the minimum requirement is you have to pursue your master. Tapi kalau you betul-betul minat in medical device industry, okay, you don't need to, okay, you just cukup pakai degree holder, because if you have a master pun, if you want to pursue in medical device industry, the gaji, the salary is just, dia depends on minimum experience. Okay, if you want to pursue lah, that's the requirement lah. Okay, kalau in bidang-bidang yang bidang-bidang medical device industry ni, it's really looks into your experience. It's not look at your minimum apa orang kata, the tahap pengajian lah, is it you master ke, even though you degree holder.
The qualification,
Okay,
academic
so
qualification.
yes, the qualification. So it's not, it doesn't measure on your qualification itself. Okay, so my job scope, okay, I'm working with the medical supply, okay, medical supply company, which is supply medical implant to hospital. So mostly to hospital government. Okay, I'm covering Hospital Shah Alam, Hospital Banting, and Hospital Kelang. Okay, and which is all in the hospital yang central region, HKL, a lot, banyak hospital, Slim River, around the central region. Okay, so I'm working as a part of trauma team, okay, in hospital orthopedic team. So in the hospital, as you know that there is a lot of team. Okay, kita ada radiological team, okay, radiotherapy team. We have trauma, advanced trauma, which is what I'm currently doing, and we have OB-GYN, we have obstetric and gynecology team, and we have laparoscopic. Is a lot, okay, banyak. So I'm the one of dalam trauma team, so which closely related working with orthopedic surgeon. Okay, so what I do, okay, because I'm currently working with the medical supply company. So whenever the hospital want to use our implant, okay, so the types of our implant yang kita orang bawa is nail, okay, which is you can see in the X-ray. Okay, in the X-ray yang kaki tu, which is in tibia. Okay, the tibia X-ray. Okay, that's the nail yang we put inside the patient. So that's nail tu is from our company, which is from the Medtronic itself. So and you can see we still playing with the radiation. Okay, because in orthopedic market, okay, in orthopedic OT, which is operation theatre, kita orang memang we memang masuk in the operation theatre. We have to to guide the staff nurse, to guide the surgeon, to do to guide the procedure lah, to QC and QA the surgeon, if they put our instrument betul ataupun tidak, is it correct, is it the procedure is following the procedure, following the SOP. So we need to be in the orthopedic, we need to be in the what we call operation theatre. Okay, so it actually is a big challenges for me, because you have to be that same level dengan surgeon. You have to be like same what we call with the orthopedic surgeon. So whenever like orthopedic surgeon the knowledge, okay, actually the knowledge kena same level lah. Kalau orthopedic surgeon cakap pasal benda ni, and we have to know that, we have to know. So memang it's a very hard for me to catch up at the first time. Tapi dah lama-lama, when you are like familiarize everything, when the surgeon said about the anatomy, the inferior like humerus, tibia and all that, so you will get used to it lah. Okay, so my job scope will be demonstrating superior knowledge, okay, of market and customer. So actually our customer is surgeon. Okay, our customer is a specialist. So we work together closely with the specialist, and of course, we as a product specialist, we have to deliver training and support to surgeon, which is the nursing staff. Kadang-kadang the staff nurse dekat operation theatre do not know how to use your product, do not know how to work to the SOP of your product. So you have to be there, you have to be in the operation theatre to conduct, to guide the staff nurse so that all in the operation theatre is going smoothly, because at operation theatre many things can happen, banyak sangat benda yang boleh jadi sebab kadang-kadang troubleshooting, the MO salah put the nail and all that, so you have to be there to guide them. Okay, sebab actually tak semua MO actually tak semua MO and tak semua specialist know how to do the operation. Okay, they still new kadang-kadang from HO, sebab dekat level hospital dia ada level-level dia. Kita ada HO, housemanship for 2 years, and then we upgrade into medical officer, which is the doctor, we call it as a doctor, doctor, and then come up to specialist, barulah naik step up specialist and consultant. So mostly MO banyak yang not knowing how to do the operation, how to do the the operation, like some of the procedure lah yang ada. So we need to be there. Okay. So mostly that kind of my job scope. Nak kata related dengan medical physics, related because dalam operation theatre we got II. Kita ada image intensifier, which is X-ray. Okay, so we need to know, okay, sometimes memang dia orang can shoot, okay, memang especially in the operation theatre they will shoot to get the live image, okay, for the bone. So memang we everyday that I attend cases memang like exposed much to the radiation. So when I'm entering the operation theatre, so I need to wear like gown, okay, for safetyness lah. Okay, so that's currently my job scope. Okay, and then I will share my experience on medical in the medical device. So medical device is something it's really interesting punya industry, because actually medical device is something medical physics, okay, tak ramai orang tahu. It's not all, macam saya pergi intern dekat Boston, saya pergi intern dekat Boston Scientific. I like having conversation dengan the engineers there, and then currently I'm having a conversation with surgeon and specialist. So actually they said that our course medical physics is really interesting. Okay, it's not just for being a medical physicist, but in this industry, okay, in this medical device industry, actually we need some kind of that kind of the background, okay, medical physics, because in actually medical physics you can like eligible to be the process engineer in what we call manufacturing punya bidang, okay, manufacturing field in medical device industry, so you can have that kind of the position. Okay, and then for this kind of position juga in medical as a product specialist, actually is really needs for you to have the science background, have to know the anatomy of that. So medical physics we learn that. Okay, so is really sangat-sangat, orang kata macam in medical device ni, medical physics ni is actually quite related. Okay, it's like macam nak memerlukan satu sama lain lah, macam tu lah. Tapi tak ramai tak ramai orang yang tahu, tak ramai orang yang aware dengan this kind of the courses. So that's why apa yang saya having a conversation with the other surgeons, specialists and also the engineers dekat Boston Scientific lah. Okay, so next. Okay, So ni antara list of the medical devices Malaysia. So it's not ini saya buat ranking bukan atas dasar bias ke apa, it's just like what I just put randomly. Okay, so for those yang really want to get in this market, okay, which is medical device in Malaysia, so you can have join with Boston Scientific, okay, which is in Batu Kawan, Penang, exit the second bridge dekat around second bridge, yeah. And then B Brown Medical Supply dekat Bayan Lepas, also in Penang, and also the Medtronic where my company brings this product. And for those yang memang actually minat medical imaging, macam kita memang kita belajar more to medical imaging, medical diagnostic. So if you really get interest to it, okay, you can like possibly join this company, which is like Canon Medical System, because they bring X-ray, they bring CT scan, and also the Siemens Healthineer and GE Healthcare. So these three you know, the company memang they manufacture the medical diagnostic. So it's a kind like interesting lah for you to try out. And then last we have Johnson Johnson and Abbott medical device. So this kind of medical device yang you boleh masuk. So actually it's not something yang you can just like focus to be medical physicist. So jangan terlalu nampak okay, tak, kalau tak sambung master dah tak tahu nak pergi mana. So actually is a banyak cabang yang you boleh masuk as a medical physics student. So you can also get into the medical device in dalam bidang ni lah. Okay, so itu je. Saya punya slide tak banyak pun, so maybe ada some of the question ke yang boleh that I can answer.
Alright, thank you Nabila. I will contact you again. I've been planning actually to collect all the list of company so that we can introduce our course, because previously we maybe focused too much on hospitals. Yes, so I've been actually looking into which industry that we can approach so that they sort of like aware that we have this kind of course, and I'm going to send them our bulletin. So this is actually my intention for this year. So I'll definitely contact you. Same goes to Aslam as well. We'll need all the list of the company, and maybe I will need you to sort of like promote our program. Okay, there is actually a question for you. Maybe we have like 5-minute question for you, and then we have all the panels line up together. Okay, there is one from Cornelia. How do you know that you're going to that work field after graduate? Because for Nabila, okay, me as a program chairman, I did not actually force a student to like go for internship in hospital only. So to me, you are the one who will decide whether you want to be a medical physicist or you want to work in that industry. So if you aim for the future, you want to be a medical physicist, hospital is definitely for your internship. But if you plan that, no, I don't want to go for master, I just want to stop at bachelor and I want to explore something else. So you can actually choose to do your internship somewhere else. So Nabila, even during the internship itself, so she already go for Boston Scientific. She didn't went to hospital. So how do you know that you are going to work in that field? Why, from the beginning, why you actually choose to do the intern in Boston instead of hospital?
Actually I kind of memang minat medical device daripada dulu lagi, and then so memang I start to target to get into the medical device. So I try to memang try to get into the Boston Scientific, and alhamdulillah I get it. Okay, so how I gain my interest, because actually I don't really minat untuk kerja dekat hospital. I don't really like have an interest to to work in a hospital, but yes, currently I'm working, memang hari-hari kena pergi hospital. So itulah, jangan benci sangat nanti.
Join in each of the OT ke? So whenever they did the OT, you have to be there?
Yes, I work.
You have to be there.
I work every day. I work every day in OT actually.
They maybe mistaken you as a doctor then.
Yeah. Sometimes whenever I go to hospital, diorang kan ingat yang I'm a doctor actually. It's not some.
So do you like your job? There's a question. Do you like your job?
Actually is a quite hectic lah because this kind of trauma business, okay, which is trauma in orthopedic, so it's a really like you have kena time management lah because whenever I go into the cases, okay, at the same time you have to cater another case, you have to go another case like that. So memang, and saya pula bukan focus on one hospital, actually cover all the central hospital. So macam hari ni nak kena pergi hospital lain, esok nak kena pergi hospital lain. So dia macam actually seronok. It's a kind like seronok lah because you travel a lot in this kind of job. So itulah, is a quite hectic lah actually.
After graduated, is it easy or hard to find a work in this sector or space? How do you somehow found the UMMI surgical?
Oh, actually, when I started to tahu this kind of job, okay, it's actually from Boston Scientific. So, I do attend my product training, okay, which is product specialist yang buat this kind of training. So, when I involved of the product training dekat Boston Scientific, and then baru I macam, okay, ada this kind of job. So that's the one yang I discover this kind of job is exist in the world. So that's why I try to cari all in job street, dekat job street Indeed. So I try to search in the medical sale representative, so known as the product specialist also. That's the why I discover my job.
Okay. What is OT smell like?
OT smell like ubat. Smell like masa.
Okay.
Tapi sometimes
alright.
it's bau like bloody lah. Bau darah.
Okay.
Banyak lah.
Yeah. Okay. All right, can we have all the, because there is like some of the question that to me is like a general question. Can we have Aslam and Joshua together? And then we start our Q&A session.
Okay, boleh.
Joshua, are you there? Okay. Aslam, buka lah video.
Oh, okay.
I think there is like another question. Let me check the question first.
Dr. Nick.
I think they just like you end up focusing on the during master and you end up regretting. Okay, you already answered it. Okay, maybe first of the general question that most of the students interested is any tips for the interviews? Any tips for the interview? Who wants to go first? I think we should hear from all the panels because all the jobs is actually different. So maybe you can share a bit about the tips for interview or what is the experience. Maybe how many job interviews that you went before you land a job at your current position. So we go with Joshua. Let's go with Joshua first.
Okay, all right.
This is the first interview, I think.
Yeah. When I did my interview, I shared what I knew about radiation modalities and what I did, the hospitals that I visited, those experience. I shared it to my best of knowledge. So yeah, of course, you try to impress them by saying like, I observed this procedure, I observed this procedure, but I think if you pay attention during your observations in hospitals, you can for sure be able to elaborate just one or two sentences more to convince the interviewer that you are hireable, you are a good candidate. So I did that because I was really interested in RT. So that would be my tip, to pay attention in the practical time in school. And yeah, just share what you know. You don't have to share everything. Just share what you know, what you experienced, what you saw during those times. And yeah, gun specialist. It was my first interview. I did that, and I got the job, I guess. And then actually, gun, there is a. That's where I got to know in Facebook. Actually, there's a medical physicist web page where hospitals, if you're interested in hospital work, will post postings if you're looking for a medical physicist. Yeah.
I didn't know that. Can you give me the Facebook name later on? And I didn't even know that
Yes.
you have Facebook. I thought you told me that you didn't have Facebook.
I I don't, but I still don't. Anyways, I just
Yeah.
know about it.
Okay. So that I can share to the juniors.
I'll give it to you later.
Okay. That's it. Aslam?
Okay, apa nak share interview?
Interview. Berapa banyak kerja pergi interview sebelum dapat yang ni? Ke ni first one yang tu dapat?
Ni first interview terus dapat. Okay, untuk tips untuk interview, fahamkan betul-betul time internship lah paling penting. Sebab time intern memang for sure kita akan pilih apa yang kita belajar time degree. So kalau untuk kecilkan scope tu, kalau nak kerja macam buat QC ni, kena fahamkan betul-betul konsep time apa yang korang buat time intern. Sebab benda tu penting nak explain balik time interview. So macam interviewer tu tengok kita faham ke tak time intern apa yang kita buat. So antara salah satu nasihat saya, time intern tu banyak benda yang kita boleh belajar untuk kita explain time interview nanti. Itulah saya punya pandangan.
Nabila?
For me, okay, I do agree dengan Aslam cakap tadi. Memang we kena manfaatkan internship punya pengalaman because that is very like valuable, okay, when we go to interview. So I already went like 5 to 6 interview. Okay, so the most question yang they will ask you is they memang interested to know what is medical physics punya ni because most of the time I need to explain to all the employee what we
Ya,
learn.
betul. Diorang tak tahu apa kita buat, kita belajar.
Tak tahu. So my tips for interview adalah you need to study what you are apply for. You need to study the job scope, okay, and of course the company profile because of course lah bila kita minta that kind of job means that kita interest in that company. So what makes you show the interest, kenapa you apply, and you have to study lah the company profile, all the job scope, and then most of the employee akan tanya that kind of question. So most of the question yang they will ask for the personal thing is what is your weakness. Okay, sebab most of the employee akan tanya weakness instead of strength. So itulah, kena prepare lah all the common question yang they will ask during the interview.
Okay. There's a question that if Nabila and Aslam get job for medical physicists, you will take it or not? Or you really love your job now, so you're not going to go for other job like medical physicists?
Okay, for me, untuk medical physicist ni dia agak orang panggil apa, theoretical tu kena betul-betul solid. So kalau jawapan saya, kalau yelah sebab saya dah dapat kerja kan, so tak lah kot. Sebab sebab benda ni dia memang betul, kita kena betul-betul solid. Macam tengok requirement pun sekarang dah minta master kan. Sebab apa dia minta master tu? Sebab dia nak betul-betul apa panggil, nak filter kita punya knowledge tu betul-betul sesuai lah dengan kerja kita. So saya rasa saya sesuai buat kerja apa, berjalan buat QC. Benda tu sesuai lah dengan secara apa panggil, practically sesuai dengan saya. Kalau theoretically tu agak saya kena banyakkan membaca lagi lah. So itulah jawapan saya.
Do you plan to continue your study? Tak dah.
Setakat ni sekarang tak lagi kot. For now not lah to continue my study.
I just want to share a bit. I actually had a conversation with Prof. Haslan yesterday during our board meeting. He told me that in the current industry, this is not just for the medical physicists, but where our industry are heading to. They are saying that now degree are no longer priority to like how we used to have a diploma student to get a job, right? So
That's
now
true.
we are at a stage where degree are no longer special to land a job. So they are started eyeing for those having a master. Same goes to even during my time. At first, I'm a bit reluctant to continue my master degree, but an advice from a lecturer at that time. If you plan to do something in the future, like, and then at that time there's like available scholarship, my brain. So I was advised that why not we take that chance, because unfortunately we no longer have it. We still have my brain, but it's for the excellent student with pointer 3.75 to have that my brain. But during my time, they open for anyone who actually have 3.0 and above. So we sort of like grab that chance and then continue for master, even though we still haven't sure what we are going to do in the future. So we just sort of like grab it and then try to go for another 1 year. So what I would just want to say that in the current situation, where bachelor are too common, so having a master later on will be an added advantage in the future.
Yes, I agree.
Because this is already. I'm not trying to discourage you for not having a master. I'm just saying that this is where we are heading to. For Nabila and Aslam, it's fine. They already got a job. But for all the other juniors that you're still, especially the first year student, it could be that by the time that you are graduate, at the time people are already like maybe aim or eyeing for someone who already have master. So it could be one of the added advantage. Yeah. What else? You all think which one more important, marriage or career? I'm not so sure. Do you want to answer that, Shuma? Compared to the other, I think you are. Yeah. Because some people will say that, okay, okay, this is an honest opinion was asked to me by a student. Because Aslam and Nabila, okay, you said that your work always like traveling. And Joshua, you said that yesterday you just back about you're at 11 p.m. So it could be now, okay, it's what is important, but it's actually marriage and career. Because some people try to find a career that will have just maybe 8 to 5.
8 to 5.
Yeah, so that you don't have to go more than that, and then you will have time to spend for your family. So at the moment that traveling maybe seems fine, but when you have a family, would you still like love the job who asks you to travel frequently? Maybe that's a question that we're trying to ask. Yeah.
Okay, Nabila boleh jawab.
Kenapa Nabila?
Okay, ada soalan yang pasal saya punya job description ke apa, boleh straight nak terangkan.
Okay, Aslam, saya nak tanya something. So did your company actually provide a consultation for maybe X-ray room to know whether the spec is good ke? Sort of like consultation pasal design lah.
Specification design setiap X-ray room tu adalah my company discuss pasal business tu, tapi at the moment the business is not there lagi lah. Pasal spesifikasi bilik X-ray, berapa LED apa guna apa semua kan, kita orang ada lah buat ni, tapi tak formal lagi lah buat business tu. Tak consult lagi lah bagi pasal description bilik X-ray tu, tak ada lagi lah, formally tak ada lagi lah.
Okay. So after graduating, is it easy or hard to find a work in this sector or space? Susah tak nak cari?
Bagi
So
saya
since tadi
dia
Atas cakap kan, so kita dekat universiti kan tak bagi tahu which company that you should actually cari.
betul.
How do you somehow found that?
So
Maybe
ni personally saya ambil saya punya ikhtiar sendiri ya. Saya tanya senior apa nama company apa semua kan. Saya banyak tanyalah apa yang company dealing with our course, our degree ni. So saya banyak tanya senior. So adalah beberapa orang senior cakap company ni buat benda ni. So saya try apply. So dapatlah. Tapi kalau nak tahu tu boleh je cari apa yang company buat radiation punya business. Ada banyak lagi. Nanti saya boleh share dengan Dr. Sakinah apa lagi company selain Alips ni yang buat. So dari situ student boleh tahu dah mana dia nak tembak dia punya resume ke apa kan.
any other question? You all must take special precaution during COVID. So that one is definitely. Any other question from the student? Aslam ada orang nak recommend your company.
Can I can recommend I can recommend for you for my company. Yeah, you can send your resume to me personally.
Any other
Tapi
question? Tak dapat apa.
Kenapa piduk ni dia tanya doktor, yang lain tak tanya?
Itulah. Any other question? I think they want to know whether like about the market itself. Senang tak nak dapat kerja with our degree? Maybe a bit tips for resume ke? How do you prepare your resume? Apa benda subjek yang nak dalam tu? Maybe sort of elective course juga ke? Which elective course?
Apa penting juga macam contoh elective course compared to minor, my opinion more to elective course lah. Sebab elective course ni nak to make our core punya subject bagi solid lah. So dalam resume tu boleh letak kita punya elective course, dari situ boleh proof kita punya degree kita solid lah kat situ compare kalau kita ambil minor kan. So tak ada masalah pun nak ambil minor. Kita punya course subject tu still solid juga. Tapi kalau nak add for elective courses pun tak ada masalah. So depends masing-masing punya opinion lah.
Okay. Another question? Tak ada lah question? Habis dah semua? Is there any job scope that we can apply for the jobs yang we discussed today? Mungkin nak share from previous experience ke? So beside the QC just now, QC engineer, besides a product specialist, medical physicist, any job scope tak yang mungkin apply? Rasa-rasanya lah, go through.
Macam saya cakap tadi, kalau lelaki boleh try go to oil and gas punya business. Boleh kalau setengah company yang dealing with source, untuk bawa source tu untuk buat oil piling, nak check, nak sedutkan source tu, bawa masuk source. Dari situ kan boleh juga job description in oil and gas punya oil and gas punya scope. Tapi oil and gas punya scope lagi tak ada masa dengan family kalau dah kahwin. Itulah dia punya kelemahan dia. Kalau saya punya jawapan saya ada je offshore. Kalau nak buat duit lebih sikit offshore boleh. Selain daripada buat QC, product specialist, medical physicist. Kalau ada basic radiation boleh juga go for offshore.
Okay. Nabila ada nak share something?
Kalau from side medical device, maybe untuk side engineer, boleh jadi process engineer, manufacturing engineer. Actually, we are eligible to be engineer also lah. It's not some engineer student yang boleh masuk jadi engineer. For medical device, it's not required for you to have the Bachelor of Engineering. Okay, so actually physics student pun, and especially medical physics pun eligible untuk dapatkan the title of engineer itself. dekat many of industry lah. Itu saya lah from my side.
We actually have a lot of seniors who have worked as engineer first before they actually become a medical physicist. Because I have a few friends who end up like working for about 2 years as engineer before she was able to actually land a job as a medical physicist. Because yeah. Any latest advancement of the dosimeter that perhaps in the planning at your company?
Okay, latest advancement ni maksud saya boleh jawab berdasarkan experience saya yang tak berapa lama ni kan. Dia contoh macam perbezaan antara OSL dengan RPL. Contoh OSL ni dia more to detect high dose. High dose ni kira kalau OSL ni dia punya reading accuracy dia lebih kepada high dose lah. Kalau RPL more to low dose punya. So contoh low dose saya bagi ni any radiographer yang dealing dengan general x-ray, mobile x-ray, so semua tu dia exposure more to low dose lah. Kalau contoh high dose ni yang apa radiation worker yang work with the source, contoh dia buat NDT, oil and gas so dari situ RPL punya OSL punya reading more accuracy lah. So itu antara advancement, tapi jarang company nak ambil setengah worker ambil RPL, setengah worker ambil OSL. Selalunya kalau satu company ni dia ambil OSL, semua worker dia ambil OSL. Satu company ambil RPL, semua ambil RPL. So senang nak dealing dengan duit apa semua kan. So bila kita ambil dua, banyak invoice, banyak nak kena buat kerja lah. Selalu company, so advancement tu tak ada lagi lah. Satu OSL, satu apa panggil pocket dosimeter boleh baca dengan accurate dia punya low dose atau high dose. So, kelemahan dia ada satu OSL, accuracy dia more tu high dose, RPL low dose. Dia macam tu. Advancement untuk masa depan tu tak ada lagi lah. Satu OSL, accuracy semua tu setahu saya tak ada lagi lah. Itulah jawapan saya.
Joshua, can you share any interview questions for the medical physicist position? Mr.
Sure.
Question
I
asked.
only can share some because I didn't attend many interviews. But one of the few questions that I remember was they asked for my experience in since I applied to the radiotherapy department, so they asked about my radiotherapy experiences. So I just shared my practical during my program. They don't expect you to know since you are a fresh grad, since I was a fresh grad. So they don't expect you to know treatment planning. They don't expect you to know how the workflow is. They just want to know how much you know or how much I know. They'll teach you. Another question that I can remember is I don't think it's that much related, but like what do you know about other modalities in radiotherapy? Like, this is more of a theoretical knowledge. So other than testing your knowledge, I don't see how that question can be helpful. I mean, you just have to learn out. And I think Nabila, I think she mentioned, like, if you're interviewing for a position, you need to learn about the company. So for Sunway, I learned the machines that they have. And ask that question actually, do you know like what machines do we have? So that was asked. So learn about the company. Yeah, I can only remember those for now.
Okay. Cornelia asked, Joshua, were you undergraduate or master's graduate? Perhaps you want to explain again your background, starting from your undergrad and then your master's.
My undergrad was in physics. I have 2 masters. My first master's is in physics, and then I get my second master in medical physics. Why? Because I didn't do anything physics related in my first master. With my first master, I was actually a customer service agent in Penang. Anyways.
Okay. Okay. Is there any sponsorship to take any of the certificate mentioned by any of our participants? So Aslam, when you take your RPO, did your company maybe sponsor you?
Yeah. My company sponsor my course for RPO. Then I have to bond to my company like 2 years. Then so tak payah bayar lah. So kena bond dengan company tu. Selepas 2 tahun baru boleh, kalau nak caw lah. Kalau nak jump to another company within that 2 years, I have to pay the balance lah. Prorate how long I work for the company, then prorate with the time that I've worked for the company. So my company sponsor my course lah.
RPO. Is there any different, like other certificate semua selain daripada RPO?
So basically RPO ni dia macam basic punya paper lah. Before nak ambil another paper, macam RPO dia ada 3 level. RPO level 3, level 2, level 1. So basic punya RPO is level 3 lah. So bila dah habis level 3, then you want to take another paper level 2 or level 1, you can, because you already have the RPO 3. Other than RPO, we also have the league test paper, league tester. Banyak lagi lah paper yang boleh
So
korang nak.
different certificate lah. So semua benda tu different certificate lah kena ambil.
Different tu maksudnya according to what the personnel in the company to do the business. Contoh, satu company ni kita nak satu league tester. So league tester tu kena ambil exam league test. Macam tu lah. Kalau satu company ni dealing dengan nuclear gauge, so dia kena ambil RPO level 1. Macam tu. Macam RPO level 3 ni dia
level tu determine by job scope lah. You will actually determine by job scope.
Macam level 3 ni dia cover semua. Level 2 ni more to radioactive source, tak salah saya. Level 1 ni nuclear gauge. So ikut
tapi
apa,
kena ambil satu dulu. Tak payah. So boleh jam terus pergi.
Tak boleh jam, kena ambil 3 dulu.
Oh, okay.
Kena ambil basic dulu.
Alright. As for intern student, when do you think is the right time to apply jobs? Can we apply the job during internship, or we have to wait until we graduate? So maybe all the three panels would like to.
Okay, for my opinion, it is very good to you to find the job within your internship. So, jangan rehat time internship. Ingat nak rehat dulu, tak payahlah. Time internship tu minta terus. Kita takut apa panggil tak sempat masa. Macam tu lah lebih kurang. So time internship minta dia terus kerja.
And then wait any other sponsorship? I don't think so. So most of the time will actually come from the company that you are working on. What is your good salary for the fresh? What is the good salary for the fresh grad? I'm not so sure if you want to share how much your salary is.
Itu PNC. Private and confidential.
Maybe the range, the starting,
Maybe
I don't know.
Starting tu ikut business.
2,000 plus, does it reach up to 3,000?
Ikut business company lah. Business company tu kita tengok business company tu okay, mungkin kita boleh pergi 3, mungkin kita boleh pergi 3 lebih. Kalau macam moderate company, biasa je fresh grade 2,5 paling rendah lah.
I do agree
Macam contoh kerja macam kita banyak travel ni, dia ada pula dia punya allowance. Allowance tu yang banyak lah sikit membantu.
Okay.
So tak boleh lah share.
So because Nabila doesn't have only bachelor, so Joshua have master. Yeah.
Nabila hasn't shared.
What?
Nabila already shared.
Oh,
yeah.
Okay.
But yeah.
I'm not saying that this is my salary, but I've asked a lot of people before I went to the interview. The starting fresh graduate degree, what do I say? Fresh graduate medical physicist is around 3,000 to 3,500.
Yes, betul.
About that range.
Medical physicist basic paling rendah 3,000.
Yes.
Because you already have master with that. It's just that I don't know. There is actually one student who worked for about 2.5 years. She said that she's a bit reluctant now to be a medical physicist, even though she was offered with a medical physicist position, because her current job scope as a product specialist have a double salary of a medical physicist. Because it depends sometimes, because if you really can give an added advantage to your company as a product specialist, because they even send her to travel in a lot of countries for training and stuff. So she's really an asset to the company. So of course the company are willing to pay a lot more to her. So even though she sort of interested to be a medical physicist, now a salary has become sort of like something that stopped her to be a medical physicist because of the salary. Because the starting, and I think medical physicists also, after you have an experience, of course, they'll pay you more, because things related to the private is a bit easy compared to government, because government has its own grade, because it's started to have the grade 41 and grade 44. Because I have a grade, but with the private, as long as your so the employer thinks that you did better and have an extra money, so definitely they will actually pay you more. So that's a good thing about the private, yeah, compared to the government. Because government, we already have our own grade. You can't really jump over. Yeah. Can you share your first day experience at work site? Have you ever encountered any problem while doing your job? If you do know how to handle it. Yeah, what is your first day experience?
Okay,
Maybe
Nabila
I
jawab
think all
dulu.
the parents let's Nabila jawab dulu. Okay. The first experience at OT, inside OT.
Yes, yes. My first experience memang they assign me to go to OT dekat H-Star Kelang. So of course my first time experience dekat OT feel like macam is a bit takut, because we can see like memang live how they do the operation and all that, but actually it's kind of fun. It's kind very fun experience when we dalam OT. Actually it's not something like very tension dalam OT. It's very yeah, okay. Actually when the operation theatre is ongoing, they play a song because the MO don't want to stress over in the OT operation. So actually it's a kind of fun lah.
Joshua, is it similar to when you're actually doing your internship at Bagan Hospital?
No, but I never. I was mostly occupied with QA, machine QA. But in some way, in my first week actually, I did manage to go into OT once, just once, and I can attest to that. That they do play music. Surprising, very surprising to me. Yes. It was a IORT, intraoperative radiotherapy. So we have to prepare the machine on site. But my first day at Sunway, I was very surprised. I thought I would have a few days before I started working. But on my first day, I started contouring, like a real patient scan, and I started contouring, learning how to contour. So yeah.
Aslam?
Ya.
Soalan
Share
tadi
apa?
lah.
First
The
day.
first day.
First day. Oh, first day saya work dekat company ni, saya terus tengok my superior did the competency test from KKM, which means the KKM staff will supervise apa yang kita sebagai tester boleh buat ke tak untuk dapatkan sertifikat. So first day saya datang, saya dah tengok dah KKM datang, check setiap tester ni atau engineer ni boleh buat ke tak untuk sebelum nak dapatkan sijil tu yang competency test tu. So saya dah takut kat situ, macam kita baru masuk, lepas tu tengok KKM dah datang, tengok apa saya punya superior tu boleh buat ke tak boleh buat. Tapi superior saya tu dah kerja lama lah, 2 tahun. Tapi takut lah sebab first time kan, kita tak tahu lagi prosedur, tak hafal lagi apa semua setiap ni, tak tahu nak buat macam mana. Itulah, tapi cara saya handle tu slow-slow lah, makan bulan lah kita nak belajar satu-satu. So benda ni memang orang panggil apa, makan masa nak fahamkan konsep tu, macam mana nak buat apa semua tu. Agak lama lah.
There's one more question. I realized that Miss Nabila said the job was hectic, stress, and occupied. Like you said, same goes to Joshua and Aslam as well. Even today, the reason why we start a bit late also because after one panel said that she's still in OT, and then Aslam also said the same thing. The QA just finished at 7+. So you mean I mean the jobs, it could be like very hectic and occupied. So how you go actually eliminate all the tension? How do you actually eliminate all the tension?
Macam mana? Setakat ni tak tension lagi lah.
Susah nak jawab.
Setakat ni tak tension lagi. Dia macam enjoy lagi buat kerja. Mungkin sebab baru lagi kan. Dah lama nanti mungkin datang tension tu.
Okay, Joshua? Anything to comment?
Yeah, I agree with Aslam. Now, I'm still very new. I guess the closest moment I've been to like being tensioned or stressed was the 1 day sim. Doctor scanned patient the same day and then want the treatment the next day. So that was really hectic. That happened yesterday for me. And so, but since I'm still new, so the stress was shared among the team. We have 5 physicists. So yeah, so the group culture, the work culture there is that if you struggle with something, we do it together until 10. So yeah, it was really helpful to have that.
Dia sebab currently we are dealing with the learning phases tau, learning phase. So learning phase ni dia tak ada lah lagi tension tu. Dia macam baru kita nak belajar kan. So macam tak sepatutnya kita rasa tension lah macam tu lah. Bila dah lama, dah power, dah bosan lah. Mungkin kita tension, kita nak lompat, kita nak experience baru lah. Kat situ kita tension lah. Bila dah bosan buat benda sama setiap hari kan.
So use this time to learn, make mistake, and feel some tension, but trust your seniors.
Alright.
Kalau macam saya pernah attend case like the duration is about 14 hours directly. So actually macam mana, how do I overcome my stress? Actually the OT staff itself lah, they macam when the operation ended and then all the great thank you and the bila operation tu dah memang successfully done, so actually that's the way I release my stress lah, because bila dah selamat operate and all the staff is happy, surgeon is happy, and then actually it's a kind of like satisfaction lah there. So that's the thing yang memang every time when I go to OT, yes, it's kind of like rewarding lah when all the surgeon and all the specialists is happy. So kita pun rasa macam okay, seronok. And then you can go back to your home like happy. Macam tu lah.
Alright, any other question? From the juniors? Because it's quite late already, it's almost 10:30.
Do fill out the form for my
I've
CSD.
captured the form for the My CSD. Please fill it out. If you want a My CSD, if you don't want the My CSD, so you don't have to fill in the form. And just to let you know that we have our social media page. We just started Facebook and Instagram. So kindly share it with others so that we can share all the information about our program, about information of the medical physics. Okay, I guess there is no other question from the audience. And lastly, I really want to say thank you to Aslam, Nabila, Joshua. I believe that today is very hectic for all of you, but still thank you for spending your time with us. Definitely are going to call you again and in the future. Because previously we have a lot of alumni, but I think we do not have someone like Aslam and Nabila. Medical physicists, we do have quite a few that already give a talk. But still, I think that Joshua, you are very lucky, I would say, because most your, I mean, based on what you actually have shared with us, the question asked and the environment that is actually you have now as your working experience is very good. Yeah. Some students face a very bad experience during the interview, from what I heard. Yeah. Okay, that's all. Thank you also for all of you that are saying until 10:30. It's late now. But I really wish all the best for your future. And what I want to say as well, please think ahead what you want to be in the future and then decide it well when you're actually preparing for your elective courses, internship, and then towards your career in the future. So this is actually the aim of this talk, so that you know what are the options as a medical physicist. Do not just how do I say limit your boundary as a medical physics student to be a medical physicist, because you have huge chunk of physics in your course as a medical physics student. So that physics are very useful for other courses as well. Okay, that's all from me. Thank you, everyone.
Thank you, everyone.
Thank you.
Welcome. Thank you, Pidot.
Different program. Okay. I'm sorry if I didn't answer some of your question, just in case I missed it. Yeah. Okay. Bye, everyone. Assalamualaikum warahmatullahi wabarakatuh. Good night. Oh, sorry. Before that, can we have a photo together?
And
Oh, most of you. Can we have a photo together? Just a few moments. Can anyone? Yeah. Because it's very difficult to have all of you together today. Can we have a photo together? Just in case you can turn on your videos. Boleh tak?
Dr. Nick mana Dr. Nick?
Ada sekejap.
Ada.
Mask on or mask off?
Mask off mask off.
Are you still at hospital, Joshua? Or already back? Nabila pun dekat office, kat rumah. Aslam kat rumah lah kot.
Saya
Kat rumah. Bawa balik SKL lah dia.
Okay. Tak ada orang pun on video kita je ke?
kita je doktor.
Boleh lah, kita je. Doktor ni mana Doktor ni? Dah tak ada dah, hilang dah. Doktor ni ambil gambar tu lah. Jom lah. This one will get into the bulletin, so at least we have a few photos.
Come on guys, come on.
Semua dah ready nak tidur kan?
Yang ladies maybe might be grab the tudung and all that. They need to siap-siap.
All the guys, please. Ada tak yang nak ambil gambar ni? Because at least we can put it in our next bulletin. Alright, Cingla then. Anyone else?
Kejap. 10 saat.
Okay. Hengji, are you there? Why don't you turn on your video?
Yes. What?
Turn on your video. Siapa ni?
This is a part of the interview. You shouldn't be what is the word for it? Shy.
Yeah.
Present yourself.
Oh, my room is so messy.
It's okay. We are not going to survey around your room. Hazika warna hitam je. Tak ada dah yang lain. That's it. Let me on off the participants so that we can have a better layout. Okay. Tak ada dah yang lain? Oh. Shira. Oh, Shira. Okay. Alright. Ready? Wait. Okay. 1, 2, 3. Smile. Okay. Let me paste this.
Dr. Nick mana tak keluar?
Ada
lah.
Ada. Okay.
Tak ada lah tadi. Oh, ada. Tak, macam kena pindah sikit. Background belakang tu dah kacau.
Boleh ke? Ustaz, macam nak buat background tu?
Kena dekat sikit muka.
Dekat muka ke?
Kena dekat
Ni?
sikit. Macam
Okay.
nampak terputar. Okay, one more time. Right, 1, 2, 3. Okay, I think that's it. Thank you so much, everyone. See you again maybe in the next program. Yeah, we will have a
Thank you,
future program.
Sakina. Thank you, panel. Bye.
Thank you.
Yeah, bye-bye.
Thank you all, audience.
Bye,
All right.
Aslam.
Bye, Dr. Nick.
Good to see you. Okay, bye everyone. Good night.
Good night.
Henry, Shira is looking for you. If you still remember Shira.
I just realized, yes, I'm here.